Hello, everybody. I see that there are still some folks waiting in the lobby. We'll be admitting them. We're going to wait just a minute or so before we get started. Welcome. We're so glad you're here with us today. All right, I see it's 1 minute past, and I know there are a few people that are coming in, but I want to respect everybody's time, so we're going to go ahead and get started. Welcome, everyone, to today's webinar, The Impact of Nicotine on Youth Mental Health. Thank you for taking time out of your day to learn about the impact of vaping, tobacco, and nicotine products on youth mental health. This presentation was created in collaboration with the American Lung Association's Youth Empowerment Advisory Group and our National Tobacco Team. And I want to send out a special thanks to all of our subject matter experts for their contributions to this presentation. Today's program will be recorded, and the recording will be shared with attendees. So note that your microphone and camera have been disabled, but we encourage you to ask any questions using the chat feature, which should be at the top of your screen. We'll be answering questions and sharing links throughout the presentation, and we'll answer any additional questions at the end of the presentation. So again, please enter any questions as we go into the chat. We will answer them as we go if we can, otherwise we'll respond at the end. My name, excuse me, my name is Michelle Mercure. I'm the Director of Nationwide Tobacco Youth Programs, and it's my pleasure to introduce our co-presenters today. So our presenters are Liz Hall, who's our Division Director for Health Promotions, Rachel Sanford, who's Manager in Health Promotions, Jessica Brost, Manager of Health Promotions. And our presenters bring a wealth of knowledge and expertise on youth tobacco and nicotine use, as well as youth mental health. I want to give a special shout out to Josie Redman, as well as Jennifer Folkenroth for overseeing the chat during today's webinar. They'll be hard at work making sure to answer questions that come in during the presentation, and anything that's not addressed will be noted via the chat for Q&A at the end if time allows. On the screen now are the learning objectives for today's webinar, and they are, by the end of this session, you should be able to recognize the trends related to vaping, tobacco, and nicotine product use, to understand data related to youth and mental health, to identify the impact that nicotine use has on mental health, and we will also provide some resources that are available to you to support a nicotine future for youth. It's important for us that we clarify some definitions as we go through this presentation. When we say tobacco products today, we mean commercial tobacco products like cigarettes, e-cigarettes, and smokeless tobacco. Note that this does not include traditional or sacred use among Indigenous communities. The term tobacco will be used to refer to commercial tobacco used for recreational purposes and not tobacco that is used for sacred ceremonies and cultural celebrations. The American Lung Association both recognizes and respects the role that traditional tobacco can play. We will also be using several terms about e-cigarettes and synthetic nicotine. We'll use the terms e-cigarettes and vapes interchangeably. We'll also refer to two types of nicotine. Nicotine can be derived from the tobacco plant, or it can be produced in a lab. The lab-produced product is referred to as synthetic nicotine. Little is known about the safety of synthetic nicotine, as it wasn't regulated by the FDA until 2022 and hasn't been fully studied. However, the effects of nicotine, whether natural or synthetic, on youth mental health are the same. Now that we've covered our objectives and the definitions that hopefully will help for you to know during today's webinar, I'm going to pass it over to my colleague, Liz Hall, to cover current tobacco and nicotine trends among youth, as well as the products that are commonly used by youth today. Passing it off to you, Liz. Thank you.
Thanks, Michelle. Let's start off with a look at youth vaping, tobacco, and nicotine use across the U.S. The data you see comes from the 2024 National Youth Tobacco Survey and the Food and Drug Administration, or FDA. As you can see and likely already know, there's a high rate of tobacco use among youth. 8.1% of all students reported current use of tobacco products. That includes 10.1% of high school students and 5.4% of middle school students. Overall, 5.9% of middle and high school students reported current use of e-cigarettes. That's 7.8% of high school students and 3.5% of middle school students. More than 1 in 4 current youth e-cigarette users use an e-cigarette product daily. More than 3 report using e-cigarettes at least 20 of the last 30 days. Almost 9 out of 10 current e-cigarette users use flavored e-cigarettes, with fruit flavors being the most popular, followed by candy, desserts, or other sweets, mint and menthol. Over half of students currently using e-cigarettes report using flavors with ice or iced in the name. We are seeing some truly encouraging trends. According to the 2024 National Youth Tobacco Survey, tobacco use among middle and high school students has dropped significantly. That's an estimated 550,000 fewer students using any tobacco product compared to the previous year. This progress is largely driven by declines in high school e-cigarette use, which fell from 1.56 million to 1.21 million, the lowest level ever recorded by the National Youth Tobacco Survey. Cigarette smoking also continues to fall to historic lows, with fewer than 2% of high school students and just over 1% of middle school students reporting current use. These are big wins for prevention and public health, and we can't take our foot off the gas. To ensure these positive trends continue into 2026 and beyond, we need to sustain this momentum through the support of our communities, volunteers, and partners across the nation. Unfortunately, ongoing budget cuts have threatened many of the public health programs that help make this progress possible. That's why our collective efforts are more important than ever to protect the next generation from nicotine addiction. Now that we've looked at national trends, let's bring this closer to home. This is Michael's story, a real story from a student whose name has been changed to protect his identity. It reflects what we hear from youth across the country. I started vaping in 8th grade, though I'd been curious long before that. Like a lot of kids, I thought it looked cool. The clouds, the tricks, the flavors. Michael went on to explain. The addiction aspect of nicotine vaping is actually way worse in reality, due to the fact that you can hit a vape almost as many times as you want. It tastes like cotton candy, bubble gum, or whatever flavor you please. You can hit it just about anywhere. It's super convenient. But that convenience comes at the price of your addiction being stronger and harder to kick. It got to the point where I would hit it regularly in between doing things for that little rush and hit of stress relief. We'll return to Michael's story later and discuss what we can all do to help prevent stories like his from repeating. Michael's story is not uncommon. Let's take a look at the product that hooked Michael's and millions of other teens. Commonly used tobacco products among youth include e-cigarettes, oral nicotine pouches, cigarettes, cigars and little cigars, pipe tobacco, hookah, smokeless tobacco such as chew, snuff, and snooze, and dissolvable nicotine products. Currently, the most popular tobacco and nicotine products among youth are e-cigarettes. Devices may be referred to as e-cigs, vapes, vape pens, dab rigs, tanks, mods, and carts. The second most commonly used product is nicotine-containing oral pouches, one of the most popular of which is Zyn. Both products contain high levels of nicotine and are often flavored to add to their appeal to youth. Tobacco and nicotine products and brands are constantly changing, so it's important to stay up to date on what's on the market. As you'll recall, Michael used e-cigarettes. However, as happens with many youth, his story did not end there. He ended up adding cigarettes and cigars to get, in his words, a more intense buzz. Different nicotine products deliver very different amounts of nicotine, but the impact on the brain is the same. First, e-cigarettes are regulated products, so the amount of nicotine you get in one cigarette is similar to what you'll get in the next one of the same brand. Next, because clean air laws restrict where people can smoke, smoking is a discrete act done a certain number of times per day in generally similar situations day to day. So a smoker might smoke first thing in the morning, in their car on the way and to and from work, on breaks, and so on. In addition, cigarettes are smoked one at a time and come in packs of 20. Most smokers can tell you where, when, and how many cigarettes they smoke in a day. As a result, a smoker can know how much nicotine they've taken in just by counting the number of cigarettes they've smoked in a day. However, these new nicotine products are fundamentally different from smoking a traditional cigarette. First, because vaping does not produce the strong telltale odor that smoking does, it can be far more difficult to detect. And nicotine pouches are very discreet and don't produce an odor at all. In addition, these new products are self-contained and ready for use at any time. No lighters or ashtrays are needed. This makes it possible for users to sidestep clean air laws and use their devices at will in a variety of settings where someone would not be allowed to smoke. Using throughout the day is also possible and common with these products. Second, vaping devices and nicotine pouches are not regulated products like cigarettes. As a result, the amount of nicotine in any given product is not necessarily the same as the next one on the shelf of a convenience store. In locally operated companies, the product's nicotine content can be even more variable and labels are not always accurate. Even with accurate labeling, knowing how much nicotine one has taken in can be very challenging. One popular e-cigarette with youth, the EBBC 5000, formerly known as the ELF bar, contains 5% or 50 milligrams per milliliter of nicotine salt. Youth would be hard-pressed to know that this translates to nearly 600 cigarettes worth of nicotine. A single vape pod can contain as much nicotine as an entire pack or more of cigarettes. These concentrated levels flood the brain with nicotine, leading to addiction. The higher the dose and the faster it's absorbed, the more powerful the craving is to use the product again. So a disposable vape isn't equivalent to just one cigarette. It's the equivalent of many cigarettes and has no lines or measures to help a youth know how much nicotine they've taken in until the vape is empty. To make all of this more clear, it's helpful to know how much nicotine is likely to be absorbed into the bloodstream and therefore into the body from popular tobacco products. One cigarette will generally deliver a bit over 1 milligram of nicotine into the bloodstream. Because the amount of nicotine varies considerably among different e-cigarette products, the amount of nicotine absorbed for 15 puffs will vary between 1/2 and 15 milligrams of nicotine, the equivalent of 1/2 to 15 cigarettes worth of nicotine. A nicotine pouch that's labeled 6% contains about a cigarette's worth of nicotine. A person using 8 to 12 of these a day, which is common, is consuming about half a pack of cigarettes per day worth of nicotine. This slide really sums up how the products we just discussed are engineered to appeal to youth and designed for addiction. Nearly 9 in 10 youth who vape use flavors. Sweet flavors make vaping products taste and smell inviting to young users. And flavor names like blue raspberry, cotton candy, and gummy bear make these products sound fun, harmless, and mask the presence of nicotine. Remember what Michael first told us. It was the flavor that was the first hook. The tobacco industry understands the appeal of novelty and is constantly pushing out new devices, new products, new shapes, new colors, and limited flavors. That kind of marketing creates buzz, collectability, and keeps youth experimenting and sharing on social media. These products are discreet. They're often small, sweet-smelling, and easy to hide. Cigarettes and nicotine pouches don't produce a lingering smell of smoke, and that means use can happen in class, on buses, and at home with little detection. The common factor among all these products, nicotine, often delivered in high doses, which reach the brain quickly, triggering dopamine surges, withdrawal between use, and a fast path from curiosity to addiction. Flavors draw them in, novelty keeps them curious, discretion hides the behavior, and nicotine seals the addiction. With that in mind, let's shift to the why, youth mental health and coping. Next, you'll hear from our licensed clinical social worker, Rachel Sanford. Rachel?
Thanks, Liz. So we talked about how flavors, novelty, and discretion make these products appealing, but what really keeps youth hooked happens inside the brain. And nicotine doesn't just affect behavior, it changes brain chemistry. So let's take a closer look at how that process works and why teens are especially vulnerable. To understand how nicotine impacts the brain, it helps to start with how the brain works in general. Let's think about something simple like playing ball. Your eyes see the ball, and neurons send that message to your brain. Your brain then sends signals to your muscles so you can move and react. That communication happens through neurotransmitters, which act like chemical messengers to carry signals between brain cells. Nicotine changes how some of those messengers work. There are over 100 known types of neurotransmitters, and one of the main neurotransmitters affected by nicotine is dopamine. Dopamine helps regulate movement, motivation, reward, and pleasure, and it's the feel-good chemical that tells your brain, that felt good, do that again. Dopamine is one of the brain's key chemical messengers. It's what helps us feel motivated, rewarded, and even joyful. In teens, dopamine activity is especially high, so their brains are wired to seek new experiences and rewards, which is great for things like learning, but it also means substances like nicotine can hijack that system. As we'll see on the next slide, there are many natural experiences that can trigger dopamine in healthy ways. Every time we do something enjoyable, dopamine helps reinforce that experience by telling the brain, that felt good, do it again. So things like listening to music, hugging your pet, laughing with friends, eating food, all of these release dopamine in healthy and balanced ways. Nicotine, however, hijacks that same reward system, releasing a much larger surge all at once. So over time, the brain starts to rely on nicotine instead of those healthy rewards. And when nicotine enters the brain, it triggers the release of dopamine. Remember, that's the chemical that makes us feel good and motivated. But that burst of dopamine doesn't last. As levels fall, the brain starts to crave that same reward. So the person uses nicotine again to get the feeling back, and soon the brain learns to expect nicotine to feel normal. This is how addiction develops. It's not from one-time use, but from a repeating cycle of reward and craving. For youth whose brains are still developing, this cycle forms quickly, and the longer it continues, the harder it is to break. Up to this point, we've been talking about how nicotine changes the brain, like how it hijacks dopamine and keeps the brain coming back for more. In this next section, we'll look at what the data tells us about youth mental health today and how nicotine use both reflects and reinforces those challenges. Let's take a moment now to look at mental health trends among youth. This is according to the latest National Youth Risk Behavior Survey data from 2023. The first statistic is alarming to see. 20% of students reported considering attempting suicide at least one time over the past year. And in 2023 alone, 9% of high school students attempted suicide one or more times. This data also reflects that 45% of youth have unmet mental health needs, and only about half reported discussing their mental health and emotional health with a qualified healthcare professional. These trends have been building over time, and since 2016, we've seen a 35% increase in diagnosed mental health conditions among teens, with anxiety and depression leading the way. And when 4 in 10 students report ongoing sadness or hopelessness, we're not just talking about isolated struggles, we're seeing a pattern that affects learning, relationships, and decision-making. That context is important when we think about substance use, including nicotine. It's equally important to highlight the positives we're seeing because there are bright spots in the data. The majority of adolescents say they have social and emotional support and at least one trusted adult in their lives. According to research, many are physically active most days, which we know is protective for both mental and physical health. These connections, supportive adults, physical activity, and belonging are among the strongest buffers against risky behaviors like substance use, and that includes substances like tobacco and nicotine. Addiction doesn't exist in isolation. It affects how young people feel, cope, and relate to the world around them. And many youth start using nicotine to manage stress, anxiety, or sadness. And what often happens is that nicotine intensifies those same feelings over time. So, what happens when you use nicotine again and again? Nicotine containing products can have a real impact on youth mental health and the developing brain. So, to circle back to our discussion on dopamine, using nicotine creates a surge of dopamine. When youth who use nicotine regularly don't have it in their system, they experience symptoms of withdrawal. Irritability, anxiety, and depression are a few of the common symptoms of nicotine withdrawal, and vaping nicotine only relieves these symptoms temporarily by creating that short-lived surge of dopamine. So, if youth are already dealing with anxiety or depression, nicotine can actually increase and worsen those symptoms. Furthermore, this repeated nicotine-driven increased dopamine production makes it harder for those who use nicotine to create dopamine without the presence of nicotine in their system. When you consider that many youth already struggle with anxiety and depression during adolescence, adding in additional burden to that could have a real impact. Additionally, many youth say they started vaping to decrease stress, anxiety, or depression. And statistics show that those with mental health conditions use tobacco and nicotine products at disproportionately higher rates than those without mental health conditions. This is a complex relationship, so nicotine can worsen mental health issues, and those with mental health issues are also more likely to turn to tobacco products containing nicotine in an attempt to self-medicate. Nicotine changes the way the brain develops, and we know that the human brain keeps growing and forming new connections into our mid-20s. The prefrontal cortex, which helps with decision-making and impulse control, is one of the last areas to mature. When nicotine is introduced during this critical period of development, it can interfere with how brain cells communicate. That can mean slower processing, difficulty concentrating, and trouble remembering information, especially in learning environments like school. And these effects can persist long after someone stops using nicotine, which is why early prevention is so important. Protecting the brain during its peak developmental years helps safeguard focus, learning, and emotional balance. Another potential impact of nicotine-containing products on the brain is how nicotine can actually rewire the brain over time. During adolescence, the brain is spending a lot of time deciding which neural pathways to keep and which to get rid of. The ones that get used the most often become stronger. That's why you can remember how to do things like add, subtract, multiply, and divide because you did it every day, but you likely struggle to remember the high school French you took that you never used again. When a young person uses nicotine, it keeps certain brain pathways active, specifically those tied to reward and pleasure. So over time, this can make those pathways stronger, which creates a lasting pattern that really supports addiction. This wiring doesn't just make it harder to quit nicotine, it can also make the brain more vulnerable to other addictive substances. And for teens who vape, it can become a small step from nicotine to products containing THC or other drugs because the behavior and the brain response are already established. When it comes to peers, peers have a powerful influence on one another's choices, and today that influence often extends beyond our face-to-face interactions. Most youth stay connected almost constantly through their phones and social media, where they can see from friends and influencers, and what they see shapes their own attitudes and behaviors. On the positive side, online communities can encourage healthy habits, connection, and belonging. But they can also normalize risky behaviors like vaping and using nicotine products. Many teens first see peers or influencers using nicotine products in posts or even stories that make it look harmless or even trendy. Research shows that nearly 60% of youth who have tried vaping say that they did it because a friend was already using, and about 30% continue because friends make it easy to access products, whether that's in person or online. The good news is that peer influence can also work in the opposite direction. Supportive friend groups, online or offline, can help youth stay nicotine-free and encourage those who are trying to quit. Empowering teens to use that same peer power for a positive influence can make a lasting impact. So far, we've talked about how peers, phones, and social media can shape youth nicotine use, often in subtle but powerful ways. But what about the signs we might notice up close? What does nicotine use actually look like in everyday life? And how can parents, caregivers, educators, and others recognize it? Many of the changes that occur may be visible to people closest to the teen. And sometimes it's not one big sign, but a combination of small shifts that add up. In fact, noticing the impact of nicotine on youth mental health, as well as potential physical symptoms, is one of the ways that parents can figure out if their children are using these products. For example, youth who use nicotine may show increases in anxiety, irritability, mood swings, or bouts of anger that go beyond what's typical for their age. Parents may notice changes in sleep, a new jitteriness, or even physical signs like a persistent cough. And there are also behavioral clues like disappearing frequently during family time, spending more time isolated in their rooms, or becoming more guarded with personal items such as backpacks, purses, or phones. During school, a student may take more frequent bathroom breaks, seem anxious during class, or say they're not feeling well more often. Students involved in sports may seem more out of breath than normal when doing activities that didn't previously bother them. These changes can be confusing because they overlap with normal adolescent behavior, but nicotine use can amplify them. It's also important to note that these changes may look the same as youth who are struggling with physical or mental health related conditions, and regardless of the setting, we want to maintain open conversation about any changes that we observe. That's why open, non-judgmental communication between youth and adults is so important and can really help young people feel safe being honest about what's going on. Youth get more out of the rewarding aspects of drugs than adults do and often experience fewer withdrawal symptoms. Youth also get fewer physical side effects from excessive vaping, so they can take in more with fewer issues. This makes getting addicted easier. Most addictions, in fact, 99% of them, begin while the brain is still developing. And as I mentioned before, the brain is still developing until about our mid-20s. That means that youth and young adults are at greater risk of becoming dependent on a substance than they will be at any other point in their lives. As nicotine is a highly addictive substance, 1 out of every 3 nicotine users will become dependent, and those who vape are 2 times more likely to become dependent than those who smoke. It's also important to note that genetics account for about 50% of the risk of addiction. So a youth with 1 or 2 addicted parents or a family history of addiction has a greater likelihood of dependence than a youth without these predisposing factors. This is why it's so important to help youth avoid nicotine product use when they're young, and for those who have tried the products to quit before they become addicted. Michael got addicted to nicotine in his teens. As he says, "It got really bad. I would try to quit and have trouble getting myself to do it. I ended up relying on my friends, which wasn't any better. My addiction only got worse as I started smoking cigarettes and cigars to get a more intense buzz." We introduced the nicotine addiction or dependence cycle during the last section of the presentation. When we look at the impact of nicotine product use on youth mental health, it helps to see how routine nicotine product use affects daily life. So let's take a closer look. Throughout their days, youth deal with challenging situations and emotions, and they're still dealing with these things when they're young and haven't developed a full set of coping mechanisms that adults might have. That means that they can feel easily overwhelmed by situations and emotions more often than adults do. When dealing with a challenging situation, youth need to find a way to cope and deal with the situation at hand. Because nicotine products produce a positive feeling due to the effect of the increased dopamine production in the brain, It can be tempting for youth to turn to nicotine to deal with issues rather than do the hard work of developing the coping mechanisms needed to deal with them. Youth use nicotine to pay better attention, think more clearly, or deal with challenging emotions, but the data shows that the opposite actually happens. So once the nicotine hits the brain, you add a new level of complexity to the situation at hand. That complexity is the nicotine dependence cycle that you see here. When the nicotine dependence cycle is added to the normal ups and downs that youth already experience, a new set of problems is superimposed onto the ones youth may have already had. Think about what we saw with the rates of suicide attempts, depression, and bullying that already exist in our youth. Some of them will also have this issue on top of the others, and while it may serve as a distraction from other issues, ultimately it only adds to their daily struggles. Michael explains how all of this feels as someone who has experienced it. It's just a never-ending cycle, chasing the feeling of comfort and low stress, when in reality, you can always be at that point without nicotine. Nicotine just increases your stress levels and makes it so that when you do nicotine, your stress levels go down temporarily. In my opinion, it's arguably the most contradictory drug because it provides nothing for you other than short-term relief that only results in your stress levels being increased afterward, leading you to want more. There are hundreds of ways to deal with stress, and learning how to cope with life stressors is one way that we can protect youth from falling for the appeal of nicotine. As I mentioned before, many teens say that they start using nicotine products to deal with stress. Learning how to deal and cope with stress can take a person a long time to find what works for them. There are many youth who are told that vaping can help with their stress and anxiety, and it's looked at as a quick fix. As many of us know, dealing with stress in a healthy way is not a quick fix. Youth must be taught healthy coping mechanisms before a quick fix like nicotine presents itself. This includes prioritizing self-care while also building resiliency to outside pressures. There are many ways and styles to deal with stress. Here are some that may be important to encourage the youth you live or work with to start implementing. Sleep and rest are necessary in proper brain development, so encourage youth to get at least 8 hours of sleep. Breaks from social media or not being on social media at all are helpful. And encourage balance. Youth are extremely busy with sports, school, clubs, work, all while trying to juggle friends and family on top of that. Encourage balance when it's appropriate to help them manage everyday stressors. There are many other ways to help youth understand stress and start dealing with it in a healthy way before they are potentially exposed to these quick fixes. In addition to teaching youth how to cope with stress effectively, there are several other strategies that we, as anyone who works with or interacts with youth, can utilize in order to prevent youth from starting to use nicotine or help them quit. So I'll now pass it over to my colleague, Jessica, who will cover the proven effective strategies and resources that you can use to be successful in your work with youth.
Thank you, Rachel. Now that we've discussed the landscape of youth nicotine and tobacco use and learned about the relationship between nicotine and tobacco use with youth mental health, we're going to discuss some proven health-effective strategies, resources, and tools for addressing youth tobacco and nicotine use. All right, one of the best ways that we can support individuals of any age, regardless of if they use tobacco products or not, is to provide education on tobacco, nicotine, and the products that contain them. This also includes staying up to date on new products so that you can easily spot the difference and can have a knowledgeable conversation about them with individuals who are using these products. Some ways to provide information and cessation opportunities are sharing lung association educational materials within your communities, educating individuals who use tobacco or nicotine to take part in one of our cessation programs, either for youth or adults. Lastly, even leading these efforts in your school, workplace, or community by becoming a cessation program facilitator for those programs that I'm going to mention in just a minute. But firstly, how do we deal with the situation we are currently facing? How do we reverse the trend? We're going to talk about what we can do together at the community level and what you can be doing within your own home even. So firstly, support restricting minor access to tobacco products. The first thing we can do is support Tobacco 21. One of the best ways to decrease youth use is to lessen the chance they can get a hold of it, right? It is known that 18-year-olds come into contact with minors at a much higher rate than 21-year-olds. So if your state has not yet passed a Tobacco 21 law, you can reverse the trend by advocating to your legislators about the importance of this policy. Other policies to advocate for can include zoning laws to restrict shops that can sell near schools, parks, or daycares. Also, smoke-free schools and parks. Something else you can do is work with your local school and let them know the benefits to offering an alternative to suspension program for tobacco and vaping violations. If they don't know, or excuse me, if they don't currently offer it, let them know that this is best practice. Not only does it keep them in school, it educates them on the product they're using in a safe, controlled environment. Lastly, review policies within your workplace, school, and at the government level. Are these policies up to date with current best practices? There are also things you can do in your own home and school setting. The CDC recommends spending time with young people can be a protective factor in curbing curiosity youth have towards these products. This can look like having dinner together, taking long walks or hikes, bike rides, a game night, and the list goes on. You could even read together in the same room. Try to have this time spent unplugged without distractions of a TV or a phone to increase that quality time. Now, during these times, what you can do is bring up the topic of vapes, what they know about them, do their friends use them, and let the youth know that the facts, let youth know the facts around these products. So make sure to educate yourself like you're doing today. Also, there's more on our website that you can look off of and read up on. These conversations with the youth are also going to act as protective factors. You can also work through coping strategies with your young ones, like the ones that Rachel just previously listed, as well as let them know of refusal strategies they can utilize if they ever find themselves in a position where they're offered these products. All right, and I'm bringing it back around to Michael, although he has quit. He has friends who have not. And he says, to this day, I know many, many people who are addicted to nicotine and have been for a long time. They can't seem to bring themselves to quit. I have a family friend who has spoken with me about his substance usage and how he has experienced being addicted to other intense substances. He says he's been able to quit every single one of them, but hasn't been able to kick nicotine. Let's talk about how we can help youth like Michael and his friend. So firstly, there are a number of intervention and cessation programs specifically designed for youth to effectively quit using nicotine products. These programs center around strategies that are relevant to youth and help them learn about nicotine addiction, develop healthy coping skills, learn assertive communication and refusal skills for dealing with situations where they might be pressured to use tobacco products. Many educational resources exist to help educate youth, parents, families, caregivers, youth serving professionals, and everyone in between. This includes resources to help schools address youth tobacco use and develop tobacco-free policies with model policy language, resources to help parents, families, and caregivers on how to talk to youth about tobacco use, and resources to help everyone learn more about tobacco products and nicotine addiction. The next couple of slides, what we'll do is go through some specific lung association resources that are available to you today to add to your toolbox when it comes to addressing tobacco and nicotine use among youth and beyond. And here on my screen, just to kind of note, this is our comprehensive approach to addressing youth vaping, tobacco, and nicotine use. This is available as a document that includes links to many of the resources that are on the screen. I'm pretty sure Josie was able to put that in the chat for us, so thank you, Josie. So like I said, some resources that we can offer you guys today is basics, okay? If you're looking for tobacco basics, how to help people quit, or talking to your child about vaping courses, we have those. We have brief intervention courses on how to talk to an individual who is currently using. So that can look like our Ask, Counsel, Treat for Youth Cessation, or Ask, Advise, Refer to Quit, Not Switch trainings. You may also want to be trained and certified as a facilitator in one of our Lung Association's curricula in-depth alternative to suspension, not on tobacco, which is our youth voluntary cessation program. And there's a much bigger array of these trainings. We could take a whole webinar just to talk about all trainings that are on lung.training. They might have the right training for you. Many of these courses, just a disclaimer, they have been accredited by Council for Tobacco Treatment Training Programs to provide continuing education credits to public health professionals. The American Lung Association has several teen nicotine and tobacco use educational materials, some of which are listed on this slide here. That's also going to be dropped in the chat. All right, and we cannot end our time today without a quick update on Michael. He says, after quite a long time of battling the addiction, I realized that it was up to me if I wanted to quit, that nobody could do it for me but me. The main thing that helped me was realizing that it doesn't do anything for you other than provide that short-term stress relief and dopamine hit. And once you get it, you feel good for a second, and when it wears off, you want to hit it more. I can proudly say that I'm 2 years free from nicotine, and I'm never going back because I feel much better, and I can confidently say that I'm never going back to that cycle again. The withdrawals will eventually go away, and the results will be worth it. Nothing in life that's worth doing will ever be easy. The will it takes to accomplish this is truly an exceptional feat, and it will only serve you more in life. I wish everyone the best of luck in their journey to a nicotine-free life. We just want a big special thanks to Michael for participating and letting us share his story on the impact that nicotine does have on youth mental health and bringing it alive during this webinar. As we end today's webinar, we'd like to leave you with just a few final thoughts. Firstly, youth mental health needs to be a priority. The prevalence of youth mental issues is something we cannot ignore and something that we must address. Tobacco and nicotine use negatively impacts teens' health and overall well-being, leading to lifelong problems. So by addressing both mental health issues and tobacco and nicotine use among youth, we can help set them up for healthy lives. Influences to use tobacco and nicotine during teen years, they are strong, but evidence-based proven effective strategies can be stronger. Lastly, every year that youth don't use an addictive substance like nicotine during adolescence reduces their risk of lifelong addiction. So let's keep this conversation going. We can prevent youth use now and keep youth from becoming dependent on nicotine for life. We hope that today's webinar have given you helpful tools to help keep up the good work we're all doing within this field of youth tobacco and nicotine use in the communities that you serve. We just want to thank you for the time that it took for you to be here with us today. And on that note, I'm going to pass it back to Michelle to facilitate our Q&A and close us out.
Jessica, So please, thank you again to everybody we have a few questions in the chat, but I do want to invite, if you have not entered your question into the chat, to please do so. And we'll take a few moments to address those and submit any questions that you have. If not now, there will be an additional opportunity for you to include those. So I see, I already see that it's answered too. Christy was asking if we can reach the links during the QR code. And all of the resources on our website are available on our website. And we will also follow up with an email that will have links to all of those resources and additional resources as well. So we will send a follow-up to all of the participants today so that you will have access to all of those resources. Are there other questions? See several requests for emails. Wonderful. Susan Fishbeck says, great presentation. We use your resources in our school district. She's a pediatrician who also wants to let people know of medical interventions for youth NRT if they can't quit. And I think that's a wonderful point, Dr. Fishbeck, that it's a great opportunity for people who are working with youth to work with their local healthcare providers to be able to address nicotine addiction in an effective way. Really understanding the history and the amount of nicotine that they're using can help to really develop a treatment plan that's going to be effective for those youth. All right, so some adolescents, an additional question coming in from Tamika. Some adolescents use marijuana by using the black and mild wraps. What are the effects of that on youth? Anybody want to take that? I see Jen's coming on. Thank you so much, Jen.
Hi, team. I'm happy to take that. Hello, everyone. Jennifer Folkenroth, Senior Director of Nationwide Tobacco Programs with the Lung Association. What an excellent question. Thank you so much for submitting that. We have absolutely seen an increase in use of marijuana across various communities across the nation. When it comes to the black and mild wraps, the black and mild wrap would would add nicotine, of course, into the device. So if they are rolling a blunt using the external paper from a black and mild and stuffing it with marijuana or cannabis, the outside shell has chemicals in it. So you do have over 7,000 different chemicals, toxic poisons that are within that wrapper. You also have contaminants of nicotine, of course, which is compounding the addictive nature to it. In addition to that, cigar paper in itself through the black and mild has a higher carbon monoxide output. So the individual using it also has an increase in the amount of carbon monoxide that they are taking into their lungs as well. So of course, what we would do is we would call this dual use, that they are dual using a tobacco product, the wrap, in addition to the cannabis or marijuana in the inside, regardless of whether they're putting tobacco in there. They are absolutely getting the chemicals, the carbon monoxide, and the nicotine from the actual wrap itself that is being used to make the blunt. So we are absolutely, very cautious when talking to youth that are using this, just making sure that they truly understand the impact that, smoking in that form or any other form presents. So hopefully that was able to provide you with a little bit of feedback so you can educate some teens on what is in that paper they're rolling that in.
Thank you so much, Jen. Appreciate that. Also want to point out in the chat, and we'll include this link in the follow-up email as well. There is some additional resources that the Lung Association has, some fact sheets that you can find on our website, and Rachel included the link to that in our chat today. Susan also added that 70% of youth have tried to quit in the last year from youth surveys. And I think that's a good reminder that for the number of youth that are nicotine dependent or are addicted, that many of them, the majority of them, do want to quit. So that's why it's so important to arm yourself with resources that you can share and provide with youth to help them quit when they're ready. Appreciate that. Any other questions? Not seeing any additional questions popping into the chat, but I do want to offer up that at any point you can contact our team at youthprograms@lung.org, and we will be happy to follow up or provide assistance or provide some technical support if need be for any of our programs or any of our resources. Since I don't see any other comments in or questions in there, I want to just send it back to our presenters to see if there's any additional comments that you'd like to share before we wrap up. Thank you, as Josie put in the chat. A PDF of the slide deck is also available, so please request that through the youthprograms@lung.org email, and we'd be happy to send you a copy of the PDF of the slides if you are interested in that. So I will wrap up for today again by saying just thank you for joining us. Thank you for your commitment to addressing youth tobacco and nicotine use. If you do have any questions, we are available for you. You can contact us at youthprograms@lung.org. We hope you have a wonderful rest of your day. Please don't hesitate to reach out to our team if you need anything additional. So thank you again. Have a wonderful day. Take care, everybody. Bye-bye.